So hello and welcome to this very special edition of the APAC Recap. I'm Viet. I am immediate past president of the Academy of PAs in Cardiology, and I get the wonderful, wonderful opportunity to sit here with Laura Ross, our current president of APAC. Now, I am also a board member of the Academy of Physician Associates in Cardiology, and today, Laura and I are going to discuss her time at the inaugural CAPP, C-A-P-P. For those who don't know, again, this is a Cardiology Advanced Practice Providers live annual meeting. We hope to continue this in a series going forward annually. But before I go on, Laura, please introduce yourself to the audience.
All thanks, Viet. Always so good to talk to you. I'm the director of the Heart Disease Prevention and Lipid Clinic at the Park Nicollet Heart and Vascular Center outside of Minneapolis, Minnesota, where we are a full meat and potatoes community. So I was thrilled to talk at CAPP about the power of lifestyle medicine and really improving the cardiovascular risk factors. So I was excited to present that at CAPP, as well as talk about non-statin therapies to get the LDL to goal as well. So Viet, you and I speak the same love language of lipids here, and so let's dive in.
Well, I will tell you that I'm a little bit more pharmaceutical based, and so I always enjoy listening to your talks. The work that you've done in your heartbeat clinic is just phenomenal, and I love that you had a chance to share that. So what do you think is really the top things that you presented at CAPP that PAs and nurse practitioners could start doing today?
We are in a powerful position to make change. Certainly, it is much easier to write a prescription for a medication and send patients on their way. But I spend the bulk of my visit really diving in to help patients find their why. Why do we want to lower our cholesterol? What are different ways we can do that? And really use a combination of lifestyle medicine as well as pharmaceuticals when indicated. And so we talk a lot about what the plate should look like. And so half the plate should be fruits and vegetables, a quarter of the plate, a whole grain. And 99% of people are like, what does that mean? So really telling them pretty much anything but white rice. They take off all the husk that has the fiber and the germ that has the protein, and it's delicious and soaks up soy sauce really well, but not a lot of nutrition. So the whole grains, barley, wild rice, brown rice, freekeh, farro, there's so many options. And oatmeal's a whole grain too, just soaks up cholesterol. Mother Nature's sponge doesn't let your body reabsorb it, and it scrubs out your arteries and your colon on the way out. So it's just fantastic head to toe for many reasons. So I can just get patients to get one serving of whole grains a day. I tell them to pick a fruit or vegetable to try. We also talk about how the American Heart Association recommends a quarter cup of nuts. Fish a couple days a week. If fish isn't part of your diet, chia seeds and walnuts are great sources of omega-3s. So really trying to tell them about food as medicine, and the reception has been great. So I was able to present our 4 years of data from our heartbeat clinic that we've been rolling out with significant improvements in almost every marker. So average drop in systolic blood pressure, 5 points. Just telling people to eat more plants and less animal products in just 2 months. An average of 10-pound weight loss in just 2 months. This isn't a weight loss trial. It's just telling people to eat more of the natural, whole food, plant-based options, a little less of the processed meat, but no dedicated amount that they had to follow. It was really patient-driven for what they found was sustainable. And I hope that my experience showed that small town girl from Minnesota can really make a change. If I can do it with my Midwestern farmers, that hopefully people felt inspired that every visit they can make a plate to really touch on lifestyle medicine.
Yeah, it was fascinating to see the data that you had with reducing multiple metrics, the blood pressure, the weight, the cholesterol. Just
that part. That's
yeah, I read the cholesterol. That was so fascinating. So thank you for recapping that. But, what's one unknown or little known fact in the area that you presented that maybe can tickle people a little bit?
We're so used in medicine, we're so used to people saying, don't eat that, don't eat that, don't eat that. Don't smoke, don't, eat bacon, those sorts of things. But really turning the tide on, these are the things you should be eating. I found has been much more effective. I think, Viet, you and I have talked too about supplements. So I think we need to do a whole talk on that at the next CAPP conference. But $30 billion a year in America, just in our country, is spent on supplements. And they're not all benign. And so why how can we as clinicians shift, patients from utilizing something that really doesn't have the data to something that has decades of data and really helping improve risk factors. And some might have side effects like statins you've alluded to in past APAC recaps, but lifestyle medicine, not a lot of side effects. So I think that's kind of an unknown, little known fact is that supplements, I don't think there's a huge place for them if you are eating a mostly whole food, plant forward diet.
Yeah, and I think that's such a great way to present this message, because remember, supplement means that you're supplementing for something that's not there or deficient. And what you've told us with regards to foods that you recommended, there's not a lot that you would need to supplement. I mean, it has everything that you need if you're eating the diet as you've taught us. So I think that's a great point. We really should present a talk on supplements and off-the-shelf type of items at the next CAPP Live conference. What's the newest guideline that's out there in regards to food as medicine or nutrition?
I serve on the nutrition committee for the American College of Cardiology, and they are doing so much work to change, from that old pyramid to really focusing more on the plate. And does it have to have a glass of milk, or does it have to have, should it be water? Can we talk about plant milks instead of dairy milks? It's so interesting that we have fruits, vegetables, whole grains, and then just a category labeled protein, so instead of seeing that, having maybe beans and legumes as an option, and thinking of meat as a condiment or a condiment on the side more than a whole quarter of the plate. So I think there's some really exciting news that I hope will make the guidelines. I think what I presented was that 1 out of 10 Americans follow the recommended amount of fruits and vegetables. So we have a 90% that we can really make a difference. And so we can keep making guidelines, but if people aren't already doing the things that we have been asking them to do, we just have to figure out how to reinforce what's out there as well. I think stay tuned as well for more of group visits. So although not guideline based, I think that's going to be a really helpful tool to get our patients and clinicians in with the guidelines to really respect reimbursement for those kinds of visits, and also a clinician's time to really dive more into lifestyle medicine. I think the other interesting thing, going a little bit back to your previous question on my non-statin talk, would really be if patients have a calcium score over 300, an LDL baseline over 190, or they have, genetic testing that confirms familial hypercholesterolemia, they often can get non-statin therapies approved. And so that would be another clinical pearl that I wanted to make sure our listeners heard for primary prevention.
Yeah, that is so important to recognize that often the inertia is that it's, quote, too hard to get folks on these non-statin therapies. But honestly, of course, do lifestyle and everything that you talked about is important for quality of life, and it supports the pharmaceutical side of things, but please don't not prescribe these medications because you're worried it's not going to be approved. The categories that you just gave are excellent categories for which insurers definitely do approve the non-statin therapies. Well, Laura, thank you so much. This has been a wonderful APAC recap. As a cardiology provider, we hope to see you all there next year. If you want to learn more, you can go to our website at cardiologypa.org. That's the APAC website. Or go to CAPP.live.com. Thanks for tuning into this episode of the APAC Recap. You can find this episode and more at HCP Live and on YouTube. We'll see you next time.